down the hallway into the endoscopy suite, which is here. And so here we have a cabinet. All of this tools and stuff will cleaned up soon. But there's some cabinet and a sink, and then there's a kind of a waiting area here, small little room, probably a desk for the nurse for sort of pre-op check-in, and then this will be for the patients, the restroom for the patients. They can get changed here in the restroom. The shower and the shower and so forth is going to be taken out, and they're going to put lockers in there so people can, and particularly the staff as well as the patients can put their stuff in there in lockers. And then this is a sliding door entry into the procedure room. I'll show you the sliding door where we just walked into. So it's a very large, or larger than average, procedure room, and there will be a hand washing sink right here in the procedure room, so that's getting installed. So this is the procedure room. I'll walk it off and get an estimate on the size of it. We're planning to put the monitor in that ceiling, in that corner spot up close to the ceiling. Will be where the monitor will be mounted. Of course, there will be the stretcher in here for the patient and plenty of room to flip it around for double and so forth. Then the patient will be on the stretcher, and this is another large sliding door. It's, I don't know, 48 inches or something like that. It's a very sizable door. We'll have the sheetrock up here. So go through this large opening to the recovery area. And so the recovery area, there will be 2 recovery bays. We've talked about one recovery bay being kind of in front of this window and along there, and the other recovery bay being along that, from the corner, that corner over to where this door was closed off, although that may change. But anyway, we'll get the recovery bays situated, and then we'll order curtains to enclose the recovery bay, kind of an L. And then there will be a chair in the recovery area, and probably kind of a nightstand in there. All right, and then there will be a desk out here for the nurses station. Now, once this is situated, then we'll, over in this corner, he's going to put 2 infusion chairs in this corner over here. And so there will be the infusion chairs, but they won't be doing infusion on the same day as endoscopy. So we'll talk about that further. The utility room is this room right here, which is formerly a bathroom. And let me see if I can get some light in here. Looks like the light is out. Hang on just a minute. Sorry for a long video. Here we go. So, walking into the utility area, here's the big scope washing sink, and then there is a drain there where a toilet used to be, and then the plan is to put the medivators in this slot right here between the sink area and this other counter. So the medivator unit will sit on a counter, and it's a countertop model. I'll show that to you in a minute. And then there will be a counter. Those are filters for the medivators. And then there's the scope cabinet. One question we have is figuring out if we can have the scope cabinet and then also have a trash receptacle for dirty linens and so forth, because they're going to be paper, if we can have it in the same room with the scope cabinet.